All right. Hello, everybody, and welcome to our final session of the first day of Singularity University's virtual summit on COVID-19 and the state and future of pandemics. We've had an amazing lineup today, which I will recap here in a bit. But for our final session, I get to bring you Julia Cheek, who's the CEO and founder of EverlyWell. But before she gets started, a quick story about the power of connection on the internet right now coming out of our last session. I had posted a couple days ago that I was just curious about who was doing interesting things related to COVID-19, and a mutual connection between us on Twitter said, oh, you got to check out EverlyWell. I saw that they had just posted that they were doing some interesting stuff, rapidly building the capacity to do at-home testing with COVID-19. I think I tweeted at you, Julia, and said, hey, we should chat. And now here we are. Yes. So thank you for being here. I'll let you take it over.
Amazing. Thanks so much, Adam. Hey, everyone out there. Excited to be part of this innovation as well. Get to present from home and get to bring this word to many more people than I would if we were presenting in person. So it's really exciting. I'm going to flip over to the presentation. I'll tell you a little bit about why EverlyWell is even positioned and chose to respond in this moment, and why we believe we are a company that can make a real difference in the quick response to COVID-19 and containing it. And then I'll also walk you through some of the choices and the decisions we've had to make as a leadership team and a board in choosing to jump in here. So I am approaching this from the lab testing side of the problem, which, as you all know now, is a major breaking point in the containment of the virus. And so you might ask how I, sitting here in Austin, Texas, as a startup founder, became an expert in lab testing. And I will tell you that 5 years ago, my entire company, EverlyWell, was founded to solve the problem of bringing lab tests direct to consumer in their homes, using virtual physicians, and creating home kits that were able to be self-collected, sent back to labs, and then resulted on a digital platform through both virtual telemedicine as well as a lab distribution network that enables you to build technology that is a one-to-many distribution. So one central platform of EverlyWell distributed to many labs around the country. That has enabled us in the last 5 years to create a massively fast-growing consumer-driven business. So we were founded in 2015. I had a problem where I went to a lot of doctors, couldn't get lab tests done. When the doctors would run the lab tests, I didn't know how much they would cost. And then I would get hit with unexpected bills in the thousands of dollars. So what that means is we've developed over 35 different tests that are shipped to your home that you request and are physician reviewed and approved. And this is everything today, from wellness and nutrition tests like vitamin D, testosterone, fertility panels, to fully diagnostic STI testing, infectious disease testing. That will become very important as we talk about the application to COVID-19. So in the last 5 years, we've scaled rapidly. We've raised about $50 million in venture capital funding from some of the biggest venture capital investors in the country. And we've really become known as the consumer-facing brand for lab testing. There's a variety of different quotes like, EverlyWell has 100,000 Instagram followers compared to Quest's 0. So I will say, over the last 5 years, our model has really been about product creation, distribution models, getting kits into the hands of consumers affordably with transparent pricing, with diagnosis through physicians virtually, and saying, how do we remove barriers in the system? I think what has been often undervalued about what EverlyWell does is the fact that we've created an entire infrastructure and distribution platform to enable this end-to-end experience for consumers in a way that's really seamless, but ultimately is about building this background of a sophisticated manufacturing and supply chain on the front end, as well as building lab capacity among multiple certified lab partners around the country. So this foundation obviously becomes really important as we talk about COVID-19 and as we talk about why EverlyWell, as a consumer business with a brand, decided to jump into the mix. So one more point that I want to make about our distribution. In the last 2 years, as we've scaled rapidly, we went from being everlywell.com and offering all of our tests through our e-commerce presence as well as through Amazon to, in the last 12 months, having extensive other channel distributions. And this has been really important in this crisis decision-making. So we are national in Target in 2,600 locations. We're national in CVS. We're national in Kroger. And then we also have health plan relationships with companies like Humana, where we do all of their Medicare and home testing, or a portion of their Medicare and home testing for things like colorectal cancer screening, blood sugar, et cetera. So we have not only, I think, been able to build a back-end infrastructure, but we've really diversified our front-end distribution infrastructure as well to be able to support these different channels. And ultimately, all of this is in service to our vision, which is providing accessible and affordable lab testing for all. And that has been where we've started, and that has been what we've remained committed to. So here's the story of COVID-19 and where we are today from an EverlyWell perspective. So I was on a plane coming back from, we work with a very large lab partner in Massachusetts called PerkinElmer, a large publicly traded diagnostics company. They run a fair number of our lab tests that our consumers purchase and send to them. And I was with our chief medical and scientific officer, who is Taiwanese, has spent a number of years in China. And he and I were talking about the global economy. And he said, you know, there's this virus in China and nobody thinks it's a very big deal right now. And he said to me, and he's not an extremist, as many physicians aren't. And he said to me, I believe this has the potential to become a global pandemic. And I kind of sat there and I thought, well, that's a really extreme statement. And he said, I've been studying the behavior of what the information we're getting out of China. I've been looking at the virus. I very much understand how the medical system works in China and in these countries. And I have concerns about this. And so the date of this was January 21st. And so I kept that in the back of my mind, but there is not a reason that EverlyWell would necessarily need to jump into this problem. And for several weeks, we didn't feel that it was either appropriate or necessary to divert our resources to trying to solve this problem. We're a small company, relatively speaking. LabCorp and Quest have 85% of the market share in this country of lab testing, even though there are over 250,000 certified labs. And so even though EverlyWell is a tremendously fast-growing business, in the scheme of the lab testing market, we're still a small player addressing a particular vertical in lab testing. And so, you know, as this started to grow, I thought, well, this is a problem, but I wasn't thinking about how do we marry EverlyWell into the solution. So as you all are well aware, we had a cough in Wuhan that then has turned into this rapidly evolving emergency situation where early on, it became very clear to EverlyWell and to Dr. Ong, our Chief Medical and Scientific Officer, and to myself, that the major bottleneck here was access to testing. So I was actually working with my comms team and saying, I need to email reporters. I need to just email them, not for ourselves, but because nobody is breaking the story around testing. And so February 29th, the FDA released their emergency use authorization guidelines around COVID-19. They released it via email and online, and then they scheduled a follow-up webinar 3 days later. And I started talking to Dr. Ong, and I said, look, I think that there is an opportunity here that we need to evaluate. Let's just sit in on the webinar and see what's going on. And it became very apparent that the CDC, as we all know, at this point admitted that the original distribution of kits to seed the development of the tests in this country had faulty reagents in them, and that there was really a call to action by the FDA, which in my mind was a game-changing day, February 29th, to say, hey, we need to open up the protocols here. We need to have emergency use authorization for these labs. But here's the thing, you have 250,000 labs, and then a portion of those actually meet the infectious disease requirements for being able to do this type of testing. And at the time, LabCorp and Quest really hadn't even been brought online yet. And I would still say it's been to a very limited extent, even today as they try to meet the need. And so we started looking at how this testing was going to ramp up. And we were comparing statements from public statements that there were going to be 1 million tests in a week. And then we were comparing it to what we were actually hearing on the ground from our suppliers, from our lab partners who were infectious disease labs, and from our attention on what the FDA was sharing. And it became painfully apparent that there was no solution. And if there was going to be a solution ramped up, it was going to take months. And so we then turned our attention toward, should EverlyWell intervene or not? And, I think there were two factors here, which was one, obviously this is a chart from Vox, but as we know, the testing per capita in the US has been incredibly underwhelming. Testing is essential for containment. And while we are past containment, it's essential that testing map community spread. Testing is able to be brought earlier in the cycle so that we're not just testing people who should already be hospitalized. It's not helpful to know then that they're positive. What's helpful is to know before they're at that severe point so that they can self-quarantine and isolate. And it became clear to me that there was no way that we would be able to match the strong response that South Korea had in containing this, as you can tell from these numbers. And so what we started doing was talking to labs. So between February 29th and March 8th, we talked to probably 20 labs, none of whom were thinking about a home test kit offering. And of course, the reason to not think about a home test kit offering is that there was an immediate crisis of a clinical setting test. And when I say home test kit, I do mean a sample collection. So collecting your sample at home, using hazardous material protocols for diseases like this, shipping it to the labs just like what they do today for courier testing with COVID, and being able to get a result. And so it became clear that if we wanted to be the immediate need after clinical setting, as it's overwhelmed and as the drive-through facilities are overwhelmed, we would have to actually see if anyone could do it. Because nobody was going to prioritize it. So we, as a startup that needs our cash, on March 8th, after a couple hours of me calling up my board members and saying, I have this crazy idea, we put out $1 million call to action as a development incentive program for a home collection test. This is a no strings attached incentive program, could help anywhere from up to 10 labs if they were able to prove that they had the FDA's EUA. And then be able to get attention on building capacity for the same test that you get in a clinical setting, a swab collection, but being able to actually ship it out and do it at home so that you can self-quarantine and you don't have to expose yourself. So to be honest with you, $1 million shouldn't have actually it should have been a drop in the bucket. It should have made no difference whatsoever. What we saw in the coming hours and days is that this ended up going somewhat viral. So we had over 250,000 engagements. We talked to close to 50 labs over the course of a week. And then we were able to we awarded our first 2 grants actually today and wired them out a week ahead of time. But we're able to get over 15 completed applications that had the FDA emergency use authorization for being able to do COVID-19 using a nasal pharyngeal swab. And so it has been a really, really quick week, but it's something where we were able to have a creative call to action that frankly wasn't necessarily a significant impact on the ecosystem, but surfaced as something that I think people really rallied behind as we brought this kind of public good approach of $1 million, partnered with obviously a private sector company that could actually build scale here. And so where we are today is on Friday, I sent out an update, which is that we are 1 to 2 weeks away from launching our test kit to the public on everlywell.com. That is from working with the first 2 labs that we've awarded grants to. The grants had no strings attached. We are still paying them for all of their costs, but they were able to develop the test so that we could actually create this relationship with them. And we'll be bringing 8 more labs online in the next 2 weeks. And so it's been a really successful program. Obviously, I'm happy to go into details about the actual launch of the test. We'll be announcing that more broadly in the next week or so as we launch it live. But I do want to just point out a few of the challenges, and then I'll wrap and take questions as to how we were thinking about this problem broadly. So I kind of told you the story. I think that there is an understanding and an attention that has been brought to lab testing that I think has really kind of been limited, which is suddenly all of you really, really care about lab testing. And while at EverlyWell, we've known this for 5 years. Suddenly there is this attention on what is the lab testing manufacturing process like? What does the supply chain look like? Why is this so difficult? Why didn't we think about this capacity, right? All of these problems. And so I just wanted to articulate for you, as someone on the ground who's talking to every lab in the country, every supplier in the country, talking to LabCorp and Quest, this is a major physical and human capital challenge that the country was completely unprepared to meet, and the clinical infrastructure that we had been investing in and the time needed to ramp this up should have started at the first sign of this, if not in November, December, then certainly in January. And so we certainly did lose the month of January and February. And what this looks like at a high level is significant component shortages globally, faulty reagents for actually running the assay in the laboratory, different timelines for laboratories to come online, sample collection matrices that are different, whether it's swab, whether it's saliva, et cetera. And then the regulatory piece, navigating CDC shipping, FDA, New York's particularly rigorous laws around consumer-initiated testing. And then I would say probably the most important challenge, and the one that I think from a public standpoint, getting the word out there is so important, is funding the test. So obviously we've diverted all of our resources as a company towards building this entire platform and launching it, and pulling these contracts and lab partnerships and supply chain operations together. But the test at cost, I don't know how many of you saw yesterday, LabCorp and Quest's Bloomberg article on this, the cost is $100 a test from LabCorp and Quest, and nobody has yet seen the free testing funds that have been promised from the government. And so we've been in active talks around how do we get access to those funds? How do we get private companies to potentially cover the costs of these tests? Our plan is obviously to make no profit. We'll actually be publishing our costs Everlane style, so line item by line item, but being able to help people understand how to get access to this affordably has been probably our biggest challenge, and something that I wish was not the case, because even if we can solve steps 1 through 3, at the end of the day, if the government isn't paying for it, someone has to. And how do we make sure that that's not you as the patient or as the consumer? I'll make one more comment and then wrap up on one more slide, which is today what you're hearing, this moment, and I tweeted about it about an hour ago, is EverlyWell has been a big part of solving and will be the laboratory capacity side. So this is the actual throughput of getting the reagent kits, getting the reagents in-house, running the samples, batching them through. This is why, for example, the Roche platform and innovation was so important, because you could run more samples through that platform. However, you can still see that even LabCorp and Quest are running a minimal number of samples daily. And even EverlyWell, if we can aggregate these 8 to 10 labs, right, and plug them into our technology, and if they can run tens of thousands of samples eventually a day, you're still looking at a pretty big bottleneck there. And the challenge that I will tell you, though, today is far greater than that challenge in the next 3 to 4 weeks. So in the immediacy of the virus are the component shortages. So there is a shortage of swabs and of supplies and of reagents around the world. And this problem has just now started to surface as the government and as private companies like LabCorp and Quest and EverlyWell will have to ration these kits. And so this then brings into some really interesting questions. And, I'm committed to kind of keeping you all informed real time and updating you on some of the decisions that we make about this product launch, but thinking through, okay, so how do you determine who gets a test? How does the telemedicine partner decide who gets a test? How do you limit it to households? How do you make sure that you're getting it in the hands of the people who really need it, but honestly, not of the people who are already headed to the hospital and the sickest, but the people who are just now symptomatic? And so there's a lot of questions here that I think, as we think about innovation in this time period, that we're able to bring together really quickly. And so all these things, I think, are questions that are still remaining to be answered and are things that I would love to have the chance to discuss with all of you. So I'll leave this slide up here. I'm going to kick it over to Q&A. I'm sure there's a lot of questions both about the infrastructure and about EverlyWell. Would love to take what we have for time for questions, and then connect with you all on social media afterward.
Awesome. Well, thank you for joining us on such short notice to talk about what you guys are up to. I felt so inspired by one, better understanding of the challenge, and then how you've really not just looked at it from EverlyWell as one business, but rather how do we get this whole ecosystem of maybe common partners in your case, but sometimes uncommon partners coming together to solve this, especially as it relates to moving forwards around. Now there's going to be these other shortages in the supply chain. How do other people come in and possibly contribute to unlock those for testing beyond even the United States?
Yeah, exactly. And I think that's another, I mean, there's so many evolving next steps to this problem. It's not just the immediate testing, which is of course the dire need right now, but how do we get rapid point of care testing in the home? How do we get platforms that have worked in other countries, and how do we fast track approvals for those in the United States? And so these are all things that we're still looking at as next steps, but solving the immediate operational need. And it's why I think startups are actually best positioned to do some of this work, not probably incredibly early startups, but a little bit later stage like us, because we are able to say, this is important enough to direct all of our resources to solving this very, very hard problem. And, I have a team working 24/7 that will be heartbroken if we don't do this. And it is a huge risk to commit all of this, but we will get it done. And I think, it's a call to action for other companies who are positioned to solve a solution in a unique way. And your speed is your advantage, especially in this kind of a crisis situation.
Yeah, definitely. All right, let's hop to the Q&A in the chat. The top question, and not surprisingly so, is can you share the projected cost of the diagnostic kit that you guys are working on?
Yeah, absolutely. So right now, it's looking at about $75. Ideally, it's free. Our costs are, because this does include overnight shipping. That is a fairly large amount of the cost. It's about $30, right? So the testing. So if I walk you through the cost, there's the shipping component of it, which, by the way, your current drive-up lab clinic now for COVID-19. Oftentimes in different geographies, they're shipping them out as well and flying them to different labs. So it's a very similar infrastructure to the current clinical structure, unless you happen to be at a facility or a hospital that has it on site. But the shipping is a very large piece of it. The kit itself is quite inexpensive. It's normal swab components. The testing itself is not particularly expensive either. These are virus detection assays. So it's anywhere from 15 to, we did have some labs quote us over $200. Those are not the labs that we're working with. So, part of, if you want to work with EverlyWell, is you have to give us reasonable costs. And so anywhere from $15 to $50 per test. And then we do have a telemedicine partner, an independent network of physicians that will diagnose you and walk you through treatment and report positives to the respective agencies. And so that's about $10 per test.
Got it. Thank you for that.
Sure.
Also, shout out to anybody who's watching that may be working at FedEx, DHL, UPS, anything that wants to figure something out here to decrease that cost even further.
Yes. So part of our goal in publishing this is kind of an idea to put pressure on the suppliers involved in this, right? If we publish and we're transparent and we're offering it at cost, how do we either get that covered, or how do we say, hey, how do all of you cut your margin?
Definitely. All right, so the next one that just shot up, which is exciting, comes to us from Connie. And Connie asks, well, first she says, what bold leadership, Julia. Congratulations. What advice would you give for others to follow their instincts / leverage their strengths in a time of need for this agility, innovation, and scale?
Well, I appreciate that. Although I will say, first of all, it's either bold or it's stupid. We don't know yet. So one or the other, and we're willing to take that failure. I would say the people we trusted in this have failed. And so if we can be successful here, then it was worth the risk. I think that in these situations, I was actually really inspired. I didn't share this as part of the story, but I was really inspired on March 8th, Friday morning, by Ro's response. So Ro is a telemedicine and prescription health company. And they very quickly pieced together a telemedicine response, not a test, but a way to kind of get in touch with a doctor to assess your symptoms. And I thought, we can be better. I thought we can be better, we can be bigger. Like, we are not, as EverlyWell, pushing our team. We have the best team in the world. We have the best consumer and medical team. How can we respond in a bigger way? And I just started brainstorming, and I felt this really deep call to action. And this is honestly, there are different types of entrepreneurs and different types of CEOs and founders. This is an environment where I thrive best. And I knew that. I make decisions well in crisis. I handle risky things well. Our team handles this well. I had a team that I knew if I sat them down and said, I'm going to ask you to work 24/7 for 2 straight weeks. What do you think about that? They would say, how much sooner can we do it? And so I got the team bought in that way. This wasn't something that I pushed down on them, right? I said, hey, let's think about this. Like, hey, let's put this grant out there. Let's see if anything happens. And then what became clear is that a lot happened, right? And so then that inspired our team to be excited to respond. But we didn't go out there and immediately say, oh, we're going to solve this problem. I mean, that would have been rash and ill-informed. And so I think it's really taking it one step at a time and thinking through where can you be uniquely positioned to solve, and what are the risks to your team, and is your team as energized by it? Because like this is at this point not me, right? This is our team executing.
Yeah, for sure. And I think I'll add to that too. One thing that stood out to me was if whether you're a company, a startup, an individual, whatever, if you have a skill that you think that you contribute to these challenges that we're facing today, just reach out. I mean, I have to imagine there's people sitting in virtual conference rooms at this point in time, just waiting for somebody to come and say like, hey, I can help you with this stuff. So if you think that whatever you're doing can be applied to any organization or individual working on this, like just reach out and see what happens.
Yeah. And I think my one last comment on this would be, don't assume that it's too small. So this is a global pandemic. EverlyWell has no business thinking about how it can be a solution. And I will be honest with you, I get text message after text message from people who I've emailed with once, right, that I barely know, saying, we're so excited and the country is depending on you, which is an exaggeration, to be clear, but it is an example of how a small company putting out a call to action, if we can test 25,000, 50,000, 100,000, 1 million people over the next 6 months, even if it ramps up much more quickly but even if it's that's more than our government has been able to test. And so don't assume that you can't make a big impact. And I think that some people shy away because the problem seems too big or too overwhelming. So yeah, volunteer, get involved, offer your skills.
You got it. I could not agree more with that. All right, we're going to try to sneak in 2 more questions.
Oh, okay.
So you mentioned that you've got a telemedicine partner. Do you have any partner building out like a mobile app to help people figure out whether or not they should get tested in the first place?
Yes. So it's not a mobile app, but our telemedicine partner, which by the way, again, as part of our existing infrastructure, we have this partner in place because we already provide infectious disease testing for STIs and full diagnosis and treatment where we can. And so what this means is that we already have this network in place positioned to do this. I need to give them a lot of credit. Our current network is PWN Health. We've had a lot of outreach from other telemedicine partners as we try to build scale. But what they're able to do is they worked with the CDC to come up with protocols that we will digitally implement, so that when you log on and request a test, you have to answer a few questions. Do you have any symptoms? Have you been exposed? Are you in an area with community spread? And then how severe are your symptoms? If your symptoms are super, super severe, we will recommend you go straight to the hospital. However, if you have been exposed or you're in community spread areas, and if you have no symptoms or minor symptoms, but there's like a cross-section matrix, you will be able to get access to a test. And again, the reason we're able to do this is because our telemedicine partner, I said, hey, are you all in if we do this? Can you step up and can you get this done and approved through your medical board and through all the regulatory bodies? And they said yes. And so that will be included in our process, as well as the included telemedicine actual positive or negative diagnosis, and then the consultation after that when you get your results. You'll have your results digitally in about 3 business days is the shortest we can do it with shipping. But in about 3 days, if you collect in the same day when you get it, and then you'll be able to get that consult right away.
Awesome. And bonus points for knocking out some additional questions that people had asked along the way in that answer.
Yeah. I'm looking at them while I can, so.
Pablo says he has a way to help improve that shipping cost. Pablo, get in touch with Julia.
Julia T. Cheek on Twitter, or just EverlyWell. If you tweet at us or direct message, we'll grab it.
There you go. We'll end on this one. As a patient, should I care if the FDA approves the test, other than the test provider, something happening to them? But on the consumer side, if if you've got a good test, why should I care that the FDA approves it?
You should care that the lab running the test has received an emergency use authorization, the EUA, from the FDA. And the reason you should care is because you need to know, you're preventing anything like false negatives, false positives, the quality of the test, all of the different specifications of the assay that have to be met in order to get an EUA. That being said, there are regulations around broader lab testing in this country by CLIA, by the Center for Medicare and Medicaid Services. And so labs in general are regulated, but in this particular case, this is not a time to be using a product that does not have the FDA emergency use authorization. What I will kind of put a call to action toward is I hope that they start approving tests that are using different types of collection. So not just the nasal swab, but saliva, dried blood spot, et cetera. And now labs are working on that too. That really broadens capacity. And so they're partnering on that as well. But you do want to be using an FDA EUA approved lab.
Fantastic. Well, thank you for joining us today. Best of luck on this journey that you're on right now. Keep us posted, and let the community know how we can help out.
Thank you. I will. We're going to release all of our decision making and launch date and everything on Twitter as soon as we update daily. So feel free to follow our journey, and we'd love your help. If you have a problem you can help us solve.
Great. Thanks for being here, Julia.
Thank you so much.
All right, everybody. That takes us to the end of day one. If you're still around, thank you for being here. Maybe some of you are just joining us because you're waking up in a different part of the world. But we know that we've had a really incredible virtual audience from all across the globe joining us today. And just want to express my gratitude for you showing up. Hopefully you can take some of this information back into your lives and apply it. And of course, we'll have some great stuff tomorrow. Let me do a quick recap just of some things that really stood out to me. Feel free to stick around or come back and watch the replay. We got started today with Divya Chander talking about, I think the most impactful thing for me was just her ability to explain how exponential growth really works, especially when it comes to a virus like this, and just how important it is to flatten the curve, so to speak, which I think we heard every single person talk about. So if you got one takeaway, that's definitely one of them. Also really appreciated how she made viruses just in general more approachable. We spent so much time talking about COVID-19, but we've failed to really talk about just how viruses work in general. Why is this one so special and different? Really want to say thank you to Dr. David Bray for coming and talking about his experience in responding to things like this in the past with the CDC. If you didn't get a chance to see that session, please go back and watch it. Really good stuff. And you get to see David in his backyard, which was so nice to hear the birds. Next, we went to Dr. Daniel Kraft, who is just one of the best that I get to work with on bringing forth cutting edge innovation. Anytime that guy's got something put together about what's happening, he knows all the cool things. So especially when it comes to things like decentralized and crowdsourced tech, that we can really use and put into place now, always makes me feel very empowered. And of course, his quote about how can we make this our finest hour, just like the Apollo team did. Next, we went to Nell Watson with some practical advice on how you can keep yourself safe and healthy. At times I felt terrified, at other times I felt empowered. But now we've got a good set of things that we can do in our homes individually, and really think about to keep not only ourselves safe, but the people around us. Then we got to talk to Raymond about all kinds of cool stuff with DNA and the possibility to cure these diseases, possibly eradicate them moving forwards, but some of the real challenges that we're going to face along the way. Outside of the great content, I think I'm most excited about his platypus channel that he's going to launch with his kids on YouTube, bringing kind of at-home science experiments and other practical things to not only kids, but adults. So like I said, I don't have any kids, but I'll definitely be tuning in. And I also really liked his message about what we owe to each other, and how we choose to handle things moving forwards is going to be one of the most important choices that we make. So think about yourself, and also think about the others around you. Robert took us on a journey through how we might redesign cities and rethink cities to make them more resilient. pandemics like this are going to continue to happen. He shared reasons why they've been accelerating. We've been seeing more and more of them, and it doesn't look like they have any signs of slowing down based on the global trends that we're seeing with climate change and the impact that that's having on our environment. But really thinking through how are we designing the physical, social, and economic elements in our cities is such an important thing to be considering right now. Then we got to go to Ellie and talk about leadership. I just loved her opening message that if you're here, you're a leader. And if you're here, you're an actor. And just like Julia just said, don't think that any action is too small. There's so much that each one of us can do right now, individually, for our families, for our communities, for those that we love. Take care of yourself, continue to do that, and we will be on a good path together. And so those are some of my big takeaways. Take care of yourself. We heard about flattening the curve over and over and over again. Listen to the local restrictions that are going on. Do what you can for yourself. Also, do your research. Don't believe everything that you see in media, especially social media. Find your trusted sources. And if you get, as Ellie was describing, the crunched up, uncomfortable feeling, put it down, take a couple deep breaths, reset, feel grounded, and then move on. And last, but certainly not least, we have to step up. Look out for those who might not be able to do that on their own. Set aside politics. We're all in this together. What matters most is what we can do right now to stop the spread, and look out for each other. So with that, if you have any thoughts or ideas on what we can do right now, please go and check out the Be Innovative platform. I'll put up those slides here in a second. We've got 6 challenges up there where we're crowdsourcing ideas. There's some good activity happening over there right now. If you want to continue the discussion, join our Facebook group that we created for this event. I'll share that link here in a second. And of course, if Singularity University as an organization can be of service to you, either as an individual, as a company, as a country, as an organization, what have you, we're here for you. So if you want help finding a partner, scaling a solution, figuring out what to do with your company, please get in touch with us, info@su.org. We'll be responding as fast as we can. And of course, go to su.org if you're looking for something specific. We're here to help connect this global network to leave a massive impact, and hopefully reduce the negative impact that COVID-19 might have. So with that, let me put up the final slide so that you guys can see it in the replay. Promise I'll get better at clicking faster. But here you go. Facebook group right here. Be Innovative right there. Thank you for being here today. Super appreciate it. We will be going live tomorrow morning at around the same time. Fingers crossed that we get over those technical glitches that we had today. But thanks for your patience. Thanks for your activity. We can't wait to see you tomorrow, where we sort of go beyond COVID-19, what's happening today, and look at the future implications that might come out of it. So we'll see you guys there.